The family glitch is fixed. Hi, I'm Kevin Canals with InsureMeKevin.com, and the IRS has issued new rules surrounding the Affordable Care Act and what was known as the family glitch. And this family glitch occurred when one of the members of the household was offered employer-sponsored health insurance, and that health insurance was deemed affordable, at least for the employee, not necessarily for the spouse and the dependents. And because it was deemed affordable, the spouse and dependents could not go to a health insurance marketplace exchange like Healthcare.gov or Covered California and receive the subsidies. These new rules from the IRS, which go into effect for the 2023 plan year, address the family glitch. And they do this by looking at the Affordability Index by separating out the family members. But certain conditions and tests need to be made to make sure that everything works. So let's go over a few of those. First, the employer plan offered to the employee must meet the minimum value standard. Now, most employer-based health insurance plans will meet this test, but always contact your human resources department to make sure that it is minimum value standard. Second, the family is the tax household family. So that is the primary applicant, spouse, and dependents. That's what is going to be looked at. All of the Affordable Care Act really revolves around the IRS and the tax family, those people that are on that federal income tax return. So that's very important. Next, what happens is we kind of start to separate the family. First, we look at the employee to see what their health insurance costs are. And because generally the employer is making a contribution, we look at the annual premiums for the employee and match it against the estimated income. And if it is less than 9.12% of the household income, it's deemed affordable and the employee cannot get subsidies. Now that 9.12%, that's determined by the IRS every year, and it can change a little bit, but for 2023, that's the affordability percentage. Then we look at the total premium for the family, and that includes the employee's contribution. And if those annual premiums are greater than 9.1% of the household income, then the insurance is deemed unaffordable and they can go to the exchange and apply for a subsidy. Finally, what can be really critical is the health insurance premium rates that are considered are the lowest plan offered by the employer. Now, many people will enroll maybe a silver plan, something better than the very lowest one, and you don't use those rates. You need to use the rates of the lowest plan offered by the employer for these calculations. So let's look at an example. So we have a household of four, Corey, Pat, Bobby, and Catlin, and you can see that their ages are listed there. Now, Corey is the employee that is being offered employer-sponsored health insurance, and Corey has gone and gotten the lowest cost monthly health insurance premiums for Corey and the family members. Now, Corey's employer makes a 50% contribution to Corey's health insurance. So Corey's net premium that he pays, that is deducted from the paycheck, is $249 per month. And when we total that out on an annual basis, that comes to $2,997. Now, Corey and Pat have gotten together and they have estimated their annual income, the modified adjusted gross income, to be about $80,000. So we take the annual premium for Corey divided by that estimated household income, and it's 3.75%. That is below 9.12% of the affordability. So Corey's health insurance is deemed affordable and is ineligible to get any subsidy through one of the exchanges like Covered California. But now let's look at the rest of the family. So we total up everyone's health insurance premiums for the year. Now, Pat, Bobby, and Catlin are getting no employer contribution, so they're paying the full premium amount, and so I've totaled up those with Corey's, and that comes to $15,147. Divided by the estimated household income, that's almost 19% of the household income. So their health insurance is deemed unaffordable. They can go to the marketplace exchange, Healthcare.gov, covered California, and apply for the subsidies. Now, this all looks very straightforward, but we know that life is complicated, and there are other rules and conditions and other programs that some of these things may contradict with, and all of the exchanges are going through and ironing out some of those and putting in additional fields within their online application to try and minimize those conflicts. But here's one thing: many people that have employer health insurance may have their adult children on the health plan, but they're not in the tax household. You do not include those adult children 26 years and younger in the calculations because they're not in the tax household. When someone goes through one of the state-based exchanges, the children that are 18 years old and younger will be looked at to see if they're eligible for Medicaid, Medi-Cal in California. So some of the children in some households may be Medi-Cal eligible, not eligible for a private plan with the subsidies. However, for the calculation of affordability, the cost of the health plan from the employer is included even if they do go Medi-Cal once the household has gone into the exchange for the subsidies. Now, Corey does not have to stay with the employer plan. He can also be on the plan in the exchange with Pat, Bobby, and Catlin, but there will be no subsidy for Corey. So oftentimes what people will do is that the employee will stay with their employer coverage because at least they're getting an employer contribution. And there may be times when that employee may want some of their dependents also on that employer coverage. And there might be a child that has a particular doctor that has a particular health challenge, and they want to keep that doctor that is only offered through an employer plan, because sometimes the employer group plans have larger networks of providers. So there's going to be a lot of different things that people need to consider, but this all starts for the 2023 plan year. So you can start working to gather the data to make all of these calculations. First, go to the employer to make sure that the plan meets the minimum value standard. The Human Resources Department should be able to tell you that. Then you need to find the premiums for the lowest cost plan offered by the employer. Not necessarily the one you're enrolled in, but the lowest cost plan. Next, you need to learn what the employer contribution is to the employee and any of the spouse and dependents, whether it's a percentage of a particular plan cost or if it's a flat dollar value, because you need to put those into the calculation mix. You need to work on developing a relatively accurate estimate of the household income, the modified adjusted gross income, which includes Social Security retirement benefits for anyone who is collecting those. So that can be a little bit different part of the puzzle that some people have not really worked with, is developing a modified adjusted gross income estimate for 2023. And then once you have all that, apply. You need to apply, and then the exchange will make a determination. Find an agent to work with an agent to go over some of these numbers, because it's going to be complicated. It's a little bit more complicated than it needs to be. It looks simple on the surface, and for some families it will be simple. For other families it's going to be a little bit more work, but it should be a good deal for families who have been cut out of the exchange because of this family glitch, where the employee coverage is deemed affordable and spouse and dependents cannot get any subsidies. For 2023, that changes. So if you have any questions or comments, you may leave them down below and I will do my best to answer them. You can go to my website, insuremekevin.com, get my email address or phone number and give me a call. I will try and answer those questions to the best of my ability. So for insuremekevin.com, I am Kevin Canals.